There's a significant shortage of primary care doctors in rural Wisconsin, and the problem is only getting worse.
In Health Watch, Shelley Bota tells us how one local hospital is helping to attract more doctors to rural communities to help improve the health of those people living there.
The Wisconsin Academy for Rural Medicine, or WARM program, is designed to attract future physicians to practice in rural communities to help combat the doctor shortage in those areas of the state. It is an education program within the University of Wisconsin School of Medicine and Public Health, and Aurora BayCare Medical Center is one of its regional campuses. For as long as she can remember, Mackenzie Carlson has wanted to work in the healthcare field.
I did some volunteering in the hospital in O'Connell Falls, and I knew that I belonged in healthcare.
Mackenzie is a third-year medical student and is part of the WARM program at Aurora BayCare Medical Center. Emergency medicine and EMS physician Dr. Bob Zempel is a member of the teaching faculty.
The WARM program was created to help address the physician shortage that exists nationally, even affecting here in Wisconsin, particularly the primary care sector, even more so in a lot of the rural areas.
The students spend their first year and a half in the classroom at the University of Wisconsin in Madison, then 2.5 years doing clinical rotations.
They rotate in a variety of different clinical settings, not just here at Aurora BayCare Medical Center, but in the surrounding community, at clinics, at other more rural hospitals, to give students another perspective on medicine and expose them to a little bit different patient population to help advance their education, other than just being in one particular site.
In the hopes that exposure will encourage students to become rural physicians.
And even help create an avenue for them to go into that sector.
Mackenzie chose the WARM program because
Having gone to high school in O'Connell Falls and gaining that feel of what it's like to be part of a rural community, I knew exactly that that is where I want to live, where I want to raise my family, and where I want to serve my community.
Plus, Dr. Zempel says WARM students get more hands-on experience than they would in a larger hospital.
Because we only have a small sector of the University of Wisconsin Medical School class, the ratio of the students compared to the clinical faculty is much lower. So you have a lot more involvement, and you're often doing things that you may not do until later in your medical education.
The opportunities for us as the only learners, really, to be able to get hands-on experience with patients in the operating room, delivering babies, etc.
Hospital officials say the program is working. They have seen many WARM students choose rural medicine after they graduate, which is what Mackenzie is planning to do.
We have family here, and I have a lot of roots here, and so I'm going to get my training and become an OBGYN, and I want to come back to Northeast Wisconsin and practice medicine.
Nearly 100 students have graduated from the WARM program at Aurora BayCare in its 9 years of being a regional campus. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Bota, Local 5 News.